It's just phenomenal to be here and great to be part of thing. I was reflecting with David beforehand, you know, the appetite within the community that we have for really pushing the boundaries and delivering services differently within our NHS and social care, you know, and the appetite from communities around advanced practice and developing professions, I think is really, really inspiring. And it's just absolutely great to see so many people here today who want to be part of the conversation. And importantly for us is that this has always been about getting our system of health and social care engaged within a conversation about designing and building part of our workforce that is so critical to delivering better outcomes for our communities. And so your views and ideas and all the thoughts and examples that we're going to use today feed into the work that we do at HEE. So I am delighted to now be Chief Nurse as well at HEE, as well as also Deputy CNO, because I had absolutely loads of time available to take on another arm's length body. But it was absolutely critical that we could start to see how we could align some of the workforce challenges and priorities that we have within NHS and social care to work across those boundaries, and really important signal to our system. Now, the kind of title you got in the flyer was kind of countered versus the title that I came up with on the train down here this morning. Why do I kind of think it's important? Well, you know, I genuinely think there is absolutely nothing more noble than the work you do in your communities. You know, if you look at the response in relation to what we do in terms of the service to our communities 24/7 as health and social care practitioners, it's really, really inspiring. You know, there are 1.4 million people working in the NHS and many, many more colleagues working in social care. You know, you are special people to get up every day and do what you do. And I think it is inspiring, really, to look at the energy and the focus that we have from people who want to change not only their own practice, but the services we deliver so our communities get better outcomes. And I think that is really important about where we frame and see ACP as being part of that. I think it's also important to reflect on the fact that actually, irrespective of the profession you are or the sector you work in, we're part of a team that is focused and wrapped around our communities, whether we work in the acute sector, in mental health, learning disabilities, or any other type of environment delivering health and social care. Actually, it is the benefit of working together that actually delivers the outcomes we see. I'm really privileged to go up and down the country like David and Bev to see many different systems and organised and how people deliver services. And I'm always struck by how people work together. Of course, don't get me wrong, there are examples when things don't work very well, and the interfaces between different parts of our systems need to be refined to give our patients and service users a better outcome in terms of what we need to do. But I am always struck by the sense of team that people bring to work every day to ensure that their patients or service users get what they need. And centred to that is absolutely leading on from David's point, which is that, you know, I will continue with every breath in my body to say that, you know, being and working in a profession as an advanced practitioner is not about, for me, substituting somebody else. It's absolutely about leveraging all of the expertise and the skills and experience that I have in a different modus operandi, as it were, to deliver the kind of outcomes that we see. And most of the time working alongside doctors and others I have in all of my clinical career, they have always tried to champion the idea of what more could we do with the skills and knowledge and capability that you bring to the table, although sometimes it is absolutely a challenge. But I also want to talk about kind of motivation, because the motivation to change is really very important. And I say this because advanced practice is not new. And the reason I say that is because we stand here on the shoulders of some pretty influential clinicians of the past who have been really championing the boundaries of what we need to do in practice. So we know that advanced and specialist practice has been around for many years, and we've had people in clinical practice in all sorts of professions pushing the boundaries before us. So we are able to now, in an environment that we operate now, actually not have to deal with some of those issues and challenges that systems and pressures bring to us. Because I think it's kind of really important to reflect that all of us in advanced practice have to reflect and identify against all of those people who have helped shape us and do that, and how we deliver as part of that. I was really lucky last night. I went to see Sir Ranulph Fiennes talk in Birmingham. It said an evening with Ranulph Fiennes. And I say this now like it was just me and him having like a light supper and a Chateau Lafite 57. But there were 300 other people in the audience, to be fair. And what struck me is part of the way through that, he said, I had the easy job, which is actually all I had to do is walk in a straight line pulling a sledge. And actually it was his wife, Ginny, who was the polar explorer, the navigator, and the 52 other people that were wrapped around him that actually, including those people who had gone before him, that gave him the motivation and confidence to deliver and deliver change. And it's the same in clinical practice, actually, is that some of the boundaries we've pushed in advanced practice have really been quite challenging. Some of them actually are really, really important and fundamental about what a nurse can do, what a physio can do, versus what others do. And often it's about other people that put boundaries on us, not what the patients want. Because multi-professional practice in advanced practice is not in any way to try and create some homogenous practitioner. It is about celebrating the core profession of nurses, allied health professions and others, that you bring a different skill set to the patient's bedside, to the patient's home, to the community that you serve, and reflecting around how advanced practice enables you to deliver those services very differently. Now, I have shared with this you before, so I do it to give you a laugh, essentially, to be fair. And before you say that hair was really on point in the 90s, that was very, very cool. I've gone for the kind of standard middle-aged cut now. But the reason I put this in here is because for two reasons. One is the kind of boundaries that we are seeing today. At the time, I couldn't even comprehend the work that you're doing in practice. To me, even when I was an advanced practitioner working as a CNS in emergency surgery, I can't even get to things. So some of the challenges that I faced in practice was consultants stopping me in the corridor and saying, there is absolutely over my dead body, will you ever examine one of my patients? Because as a nurse, you should never do that. I had the same from my nursing colleagues who said I'd sold out and was wanting to be a mini doctor. And actually, the motivation and determination for me was always the patient. What more could I do to support that and make those kind of changes? And I say this because there are many, many opportunities for us, and many of the reasons that hold us back from that are often very, very traditional views about what you should do in practice from your colleagues. So it's trying to tell us that actually advanced practice has not finished today. Advanced practice is always advancing, irrespective of the profession you're in. And each and every day we should be seeking opportunities to improve outcomes for our patients and our service users by utilising our skills, our expertise, our knowledge and our capability as advanced practitioners to absolutely do that. My opportunity came in an NHS plan that was published a long, long time ago. And we have many opportunities in the policy framework now. So even if we were to look across broadly the NHS long-term plan, I absolutely assume that this is the last thing you read before you go to bed at night and the first thing you pick up in the morning. But when I do speak to clinicians, they often say, oh, it's a policy document, it's kind of up there. And actually, if it wasn't for me reading the NHS plan, my clinical career as an advanced practitioner would never have been achieved, because what I saw in there was an opportunity to use my skills in the same way that we see in many of the aspects that we want to deliver our services in the NHS, and importantly also in social care in doing that, whether that's personalised care, whether that's multi-professional teams, moving to community-based settings, enabling technology that David has eloquently talked about, but also about community health. All of the skill sets that as nurses, midwives and AHPs working at advanced level can absolutely deliver for our communities. And I think I kind of am conscious of kind of time, but I really want to reflect on why I think ACP is at the heart of delivery. Everybody who turns up to work as in the NHS or social care is an expert wanting to lead their part of the service, whether that's some of our support worker colleagues, whether that's working at advanced practice level, whether that's a consultant surgeon. It is important that each and every one of us has a contribution to make to doing that. But one of the things I think we're really good at is managing complexity. Not only managing complexity in care, but managing complexity in process. And it is really complicated to navigate health and social care systems, but actually advanced practice does that. The research evidence shows that those handoffs between care, those handoffs between different professionals, are where some of that opportunity lies in terms of being able to do that. Supporting populations. I was speaking to some American colleagues, and I heard that the advanced practice master's program at Johns Hopkins University was closing. And I was going, oh my God, why on earth is this happening? You can't possibly. And they said, no, we're closing it because we now believe our community practitioners at advanced level should be working at doctoral level because they are the leads of population health. They need the skills and capability to look at population health for huge tracts of areas, leading care. And it struck me that they were thinking about the next journey, about advanced practice. Where does it go next? Where do we push those boundaries? But it is also important about supporting across communities and our links with social care. It is so important. Actually, we can't think about the work that we do in health and not think about the impact that has in social circumstances for people. I was privileged to be involved in a programme of work that actually looked at social medicine, something I did as an undergraduate sociology student many, many years ago. And actually, that is where I see the interface between social work and health being so critical in resolving and supporting communities, in dealing with, in some cases, quite intractable issues around deprivation, but importantly, I've got my 5-minute warning, and then the lever comes, doesn't it now? And trapdoor. No, we went for a chair, didn't we, out the back onto the pitch. So it's kind of really important about our links about managing that. But it's also about the prevention agenda. You know, I lived in the acute world and I, you know, had a blue flashing light on my head and I loved my bleep and it used to crash bleeps and all the kind of excitement of doing that. But much of what I saw was social in its presentation within the work that I did and changed conceptually the idea that actually we had huge opportunities as health professionals to look at prevention and ill health and irrespective of the intervention. I know that's really difficult when you've got a list of 15 patients in ED to see and you've got loads of other challenges to sort out. But actually it's about utilising skills and time with patients and service users to ensure that we play our part in ensuring that prevention and management of conditions is going to be the kind of future. So I'll kind of finish on why I think the ACP framework was really important because and of course you know there's always the unintended consequences. You publish a document like this and you wait for the tea and medals to roll in and the plaudits and all that happens is everybody goes, ah yes, but what about this and this? And I'm kind of reconciled by that because actually what this has done is allowed us to put a point in the sand and have a conversation about what does advanced practice look like in our professions today, but importantly, what does it look like in the future? And also, what does it mean for other people working in the health and social care system? You know, we've had a great conversation about looking around specialist, clinical nurse specialists, which I was. We've kind of importantly opened up a whole range of, I think, really important professional discussions about advanced practice, about what it means for the service going forward. But importantly, it's good enough at the moment for us to be able to start shaping services and curriculum and support to be able to leverage the benefit of doing this within the system. So it's not over. This is kind of part of the journey that we've gone on in relation to advanced practice. And events like today are to shape the advancing nature of what we want to do. And importantly, to set forward what it is our contribution as clinicians could be in a system of health and social care that I think has a massive, massive opportunity to be able to deliver change for the health of our nation. So I'll draw that to a conclusion before the lever gets pulled and just say thank you very much for your time and attention today, and I hope you enjoy the rest of the sessions. Thank you.